Cancer, a term which automatically seems to make one think of pain, suffering and death. A term which immediately makes one diagnosed with cancer ask the question, why me? However, what exactly is cancer? Why does it happen? And more importantly, how can we try to protect ourselves from it? These are some of the questions that we will attempt to address in this module.
The earliest written record regarding cancer is from 3000 BC in the Egyptian Edwin Smith Papyrus and describes cancer of the breast. However, cancer has existed for all of human history. Hippocrates described several kinds of cancer, referring to them with the Greek word carcinos, which means crab or crayfish. This name comes from the appearance of the cut surface of a solid malignant tumor with the veins being stretched on all sides like the feet of a crab. The Greek celsus translated carcinos into the Latin cancer, also meaning crab, and recommended surgery as treatment. During the 2nd century AD, Galen disagreed with the use of surgery and recommended purgatives instead. These recommendations largely stood for 1,000 years.
In the 15th, 16th and 17th centuries, it became more acceptable for doctors to dissect bodies to discover the cause of death. The German professor Wilhelm Fabry believed that breast cancer was caused by a milk clot in a mammary duct. The Dutch professor Francois de la Boe Sylvius, follower of Descartes, believed that all disease was the outcome of chemical processes and that acidic lymph fluid was the cause of cancer. His contemporary Nicholas Tulp believed that cancer was a poison which spread slowly and concluded that it was contagious. The physician John Hill described tobacco snuff as the cause of nose cancer in 1761. This was followed by the report by the British surgeon Percival Pott that cancer of the scrotum was a common disease among chimney sweeps. With the widespread use of microscope in the 18th century, it was discovered that the cancer poison spread from the primary tumor through lymph nodes to other areas, that is metastasis. This view of the disease was first formulated by the English surgeon Campbell de Morgan between 1871 and 1874.
Cancers, usually it is said that there are more than 200 types of cancers. This is because of the nomenclature. The organ that is involved, the organ system that is involved, the type of the cells that have proliferated, the type of the cancer that has occurred, the level of compression that it has generated, the level of the tumor, the size of the tumor, the level of the metastasis into the nodes, the level of metastasis into the other tissues of the body. This gives a nomenclature, and thus there are more than 200 names of the same disease cancer which generates at in a particular and said manner. First, we shall have to understand how does this disease happen to occur in human body. We know that body cells, the basic unit of the body is cell and it forms the tissues. This basic cell is always growing, always the cells are multiplying, and these multiplying cells, they replace the wear and tear parts of the body, and thus a normal pattern of the growth occurs, and this is always very well conducted in the body, and it is all equated just like a mathematical equation. That many cells shall go for wear and tear, and that many cells shall be created within a specified period of time. But cancer breaks this orderly control of the nature, and this is because certain nuclear changes do occur. That means the basic unit of the body, that is the cell, has a vital content, that is the nucleus, and that nucleus has DNA. This DNA is changed. When this DNA is changed, there are three stages: metaplasia, anaplasia and dysplasia, which stages the cancer out. And when these nuclear changes occur, the cells start proliferation at a different pace. When the pace of proliferation, pace of cell division, this differentiates, in that condition there is an overgrowth, that means an uncontrolled growth or a swelling. This swelling is known as tumor. This is the primary site of cancer that develops. This tumor basically does nothing. So, usually what we say is cancer is not a disease, it is only a compression syndrome, because the tumor increases in size gradually over a very long period, say so many years, and after that it produces the symptoms of compression of the adjoining tissues, adjoining cells. We see when the blood vessels are compressed, the adjoining cells do not get blood. When the nerves are compressed, the nervous symptoms do appear, the pain does appear, and such other things. These tumors or the cancerous growths may be of two types. One is benign, other is malignant. Benign is the one which is encapsulated, there is a sheath around it, and this tumor does grow within certain limits, but it does not metastasize, it does not go through the lymph nodes into the other parts of the body, while the malignant one is the one which spreads into other parts of the body, in the vital centers of the body also, maybe liver, maybe brain, maybe lungs, and it causes disastrous effects. When we do the grading and staging of the cancers, we know the basic way of grading and staging of the cancers are knowing at which stage are we detecting a cancer or a disease pattern. We see that there is a T and M classification, that is the tumor, node and metastasis. As we said, these tumor cells may migrate anywhere in the body if it is a malignant cancer, and when it migrates, we do not know where it is going, but we definitely know it is going to flow through the lymph, which is just like blood, a fluid tissue, and it goes into the lymph nodes. These lymph nodes are sieve like structures. They used to filter the things, filter the organisms and other things, but however the cancer cells do pass into the lymph nodes, the lymph nodes get swollen, and these swollen lymph nodes again create problems. When the metastasis is gone further, in that condition it may metastasize into the vital organs of the body. So, if there is tumor only, the cancer is at an early stage. When it is lymph nodes, it is a progressed stage, and if it is metastasized into the vital organs of the body, maybe it may be a terminal stage. So, this sort of a grading and staging is used, and this is the basic way. Other grading and staging methods are also used by medical professionals.
Several factors, both inside and outside the body, contribute to the development of cancer. In this context, scientists refer to everything outside the body that interacts with humans as the environment.
Coming to the causation and role of environment in the cancer, we see that constitution of the human body has two major factors to play in. A child born in the environment carries his or her genetic factors given by the parents, grandparents. This is one genetic constitution that comes into the body of the human being. The rest of the factors that we acquire from either and either, this is the environment where we are born and brought up. So, this environment does a lot to help us survive well, but many a times it may generate the diseases like cancer. We are coming to the same. Environment has two types of factors which the person voluntarily brings about inside his life or her life. This is the microenvironment of that person, the habits, the habitat of the person, the addictions that the person acquires, maybe tobacco, maybe smoking, maybe alcohol or certain other things, the diet that the person takes, the food, the lifestyle, when the lifestyle is sedentary, obesity is about to occur, the sexual behavior, the workplace atmosphere and the chemicals with which the person comes in contact every now and then. Coming to the involuntary factors, naturally the environmental pollution is one of the greatest things. We are polluting air with several of the chemicals. We are polluting water, and this air and water pollution acts as a major factor.
The report on carcinogens, published by the National Toxicology Program of the United States, lists more than 200 carcinogenic agents. Some of them are cigarettes, cigars, and pipe smoking, chewing tobacco, snuff, and exposure to environmental tobacco smoke, or ETS, also called second-hand smoke, are all linked to increased cancer risks. Cigarette, cigar, and pipe smoking have been associated with various cancers.
For the sake of tobacco, we know that 1,48,000 deaths each year are occurring in the world. The cancer of the trachea, cancer of the lungs, cancer of the bronchus, pancreas, bladder, urinary bladder, cervix, testicular cancers in the patients of the smoker mothers, they have been noted. Even in the smoker women, we have seen that lung cancers are more than the breast cancer incidences. In 1997, A.K. Heckshaw detected that excess risk of lung cancer is 24% in non-smokers who live with a smoker, say wife of a smoker person. And tobacco specific carcinogens are found in the blood and urine of non-smokers who are exposed to environmental tobacco smoke. So, any type of environmental tobacco smoke which causes passive smoking, not an active smoking, raises the risk of cancer by 24%.
Diet, weight, physical inactivity.
The cancer of the rectum, prostate, endometrial cancers because of high animal fat intake have been noted down. Rectal and endometrial cancers, even because of the obesity, that is a lifestyle, have been noted. Regarding the gastrointestinal cancers, that is the stomach and the intestines, the respiratory and colonic cancers, they are preventable as per the American Society of Health or American Cancer Society. It has been said that more than 5 servings of the fresh fruit and vegetables per day can prevent these GI cancers, respiratory centers and respiratory cancers and the colonic cancers. Because of the physical activity, as we know, obesity occurs, and even lack of physical activity causes many other diseases also. Just a brisk walk of 30 minutes every day heals all these things. Rather, they may reverse the process of cancer that may have generated into the body.
Heavy drinkers who consume more than 2 drinks per day have an increased risk of cancer, particularly among those who also smoke. Cancers associated with heavy drinking include cancers of the mouth, throat, voice box, liver, and esophagus. There is also some evidence linking alcohol and cancer of the breast. Ultraviolet or UV radiation from the sun, sun lamps, and tanning beds causes premature aging of the skin and DNA damage that can lead to melanoma and other forms of skin cancer. The incidence of skin cancers is rapidly increasing. Viruses and bacteria contribute to the development of several types of cancer. A sexually transmitted virus called human papilloma virus or HPV is a primary cause of cervical and anal cancer. Women who begin sexual intercourse at age 16 or younger or have many sexual partners have an increased risk of infection. However, even though infection with HPV is a primary cause of cervical cancer, most infections do not result in cancer. Hepatitis B or HBV and hepatitis C or HCV viral infections are major causes of liver cancer. Ionizing radiation is invisible high-frequency radiation that can damage the DNA or genes inside the body. Everyone is exposed to very small doses of ionizing radiation from rays that enter the Earth's atmosphere from outer space. Radiation from this source may account for a very small percentage, about 1% of our total cancer risk. Radon, produced by the breakdown of uranium, releases low levels of ionizing radiation. Higher levels of radon can be found in certain types of rocky soil. Radon causes lung cancer. People are also exposed to ionizing radiation during certain medical procedures. Patients who receive radiation to treat cancer or other conditions, or X-rays to diagnose or screen for a disease, may be at increased cancer risk. Exposures to various fibers, fine particles and dust occur in several industrial settings and are associated with increased cancer risks. Exposure can also occur in non-industrial settings. Asbestos fibers and all commercial forms of asbestos are human carcinogens. Increased rates of mesothelioma, a rare cancer of the lining of the lung and abdominal cavity, and cancer of the lung have been consistently observed in a variety of occupations involving asbestos exposure. Ceramic fibers now used as insulation materials, silica dusts found in industrial and occupational settings such as coal mines, mills, granite quarrying and processing, crushed stone and related industries, and sandblasting operations cause lung cancer. Wood dust from sanding operations and furniture manufacturing causes cancers of the nasal cavities and sinuses. Particles in diesel exhaust cause lung cancer.
A landmark study, it was a 20-year study done by OEEB and NIOSH, that heavy exposure to diesel was linked to lung cancer. This acted as a boon that even the mine workers, even the urban population that is exposed to diesel, this study gives us an insight that exposure to diesel or heavy amounts or heavy doses of diesel, in that condition the cancer may occur.
Aflatoxins are produced by certain types of fungi growing on food which create liver cancer. They grow on grains and peanuts and may also be found in meat, eggs and milk from animals that eat aflatoxin contaminated feed. Cancer treatment drugs like cyclophosphamide, chlorambucil, melphalan have been shown to increase the occurrence of second cancers, including leukemia. Immunosuppressants like cyclosporin and azathioprine used for patients having organ transplants are associated with increased cancer risks, especially lymphoma. Estrogens used to treat symptoms of menopause and other gynecological conditions may increase the incidence of endometrial cancers and breast cancer. Long-term usage of combination oral contraceptives increases early onset of breast cancer and liver cancer. Several solvents used in paint thinners, paint and grease removers, and in the dry cleaning industry are known or suspected of being cancer-causing in animal studies. These include benzene, carbon tetrachloride, chloroform, dichloromethane or methylene chloride, tetrachloroethylene and trichloroethylene. Benzene is also known to cause leukemia. About 20 active ingredients in registered pesticides in the United States have been found to be carcinogenic in animals. These include chlordecone, lead acetate, ethylene oxide, dimethylhydrazine, hexachlorobenzene, some cyclophenoxy herbicides, hexamethylphosphoramide, DDT, Mirex, Lindane, Nitrofen, Amitrol, and Toxaphene. Farmers, pesticide applicators, crop duster pilots, and manufacturers have found high rates of blood and lymphatic system cancers, cancers of the lip, stomach, lung, brain, and prostate, as well as melanoma and other skin cancers. Dioxins are unwanted byproducts of chemical processes that contain chlorine and hydrocarbons. At least 100 different kinds of dioxins are produced by paper and pulp bleaching, incineration of municipal, toxic, and hospital wastes, certain electrical fires, and smelters. They also contaminate some insecticides, herbicides, and wood preservatives. Polycyclic aromatic hydrocarbons, also called PAHs, from burning wood and fuel for homes, gasoline and diesel exhaust, soot, coke, cigar and cigarette smoke, and charcoal broiled foods, open fires, waste incinerators, coal gasification, and coke oven emissions cause lung, skin, and urinary cancers. Foods that contain small amounts of PAHs include smoked, barbecued, or charcoal broiled foods, roasted coffees, and sausages. Vinyl chloride is a colorless gas associated with lung cancers and angiosarcomas or blood vessel tumors of the liver and brain. It is used in the plastics industry, in manufacturing containers, wrapping film, electrical insulation, water and drain pipes, hosing, flooring, windows, and credit cards. Arsenic compounds are associated with many forms of skin, lung, bladder, kidney, and liver cancers. Arsenic is used in wood preservatives, glass, herbicides, insecticides like ant killers, and pesticides, mining, and copper smelting. They are a general environmental contaminant of air, food, and water. Beryllium compounds cause lung cancer. They are used as metals for aerospace and defense industries, for electrical components, X-ray tubes, nuclear weapons, aircraft brakes, rocket fuel additives, light aircraft construction, and the manufacture of ceramics as an additive to glass and plastics, dental applications, golf clubs, fiber optics, and cellular network communication systems. Cadmium metal and cadmium compounds are associated with lung cancer. Workers with the highest exposures are those involved in removing zinc and lead from minerals, producing cadmium powders, welding cadmium coated steel, and working with solders that contain cadmium. Some chromium compounds are known to cause lung cancer. The highest exposure occurs in occupations related to stainless steel production, welding, chrome plating, and leather tanning. Nickel and nickel compounds are associated with cancers of the nasal cavity, lung, and possibly the larynx or the voice box. Nickel is used in steel, dental fillings, copper and brass, permanent magnets, storage batteries, and glazes. Some precautions can be taken to try to reduce the risk of cancer. Avoid using tobacco products such as cigarettes, snuff, and chewing tobacco. This is especially important for individuals who drink alcoholic beverages. Cancer risk of alcohol and tobacco combined is greater than the sum of their individual effects. Choose most of the foods you eat from plant sources. Eat 5 or more servings of fruits and vegetables each day. Eat other foods such as breads, cereals, grain products, rice, pasta or beans several times each day. Wash fresh fruits and vegetables before eating. Limit your intake of high-fat foods, particularly from animal sources. Choose foods low in fat and limit consumption of high-fat red meats. Choose baked and broiled meats, seafood and poultry rather than fried food. Be physically active and achieve and maintain a healthy weight. Be moderately active for at least 30 minutes on most days of the week. Stay within your healthy weight range. Be aware that many fat-free cakes, cookies, snack foods, and other desserts are high in calories. Limit consumption of alcoholic beverages. Men should have no more than 2 drinks per day. Women should have no more than 1 drink per day because they absorb alcohol more readily and are usually smaller in body size. Avoid or reduce exposure to sunlight, particularly in childhood. Reduce your sun exposure by avoiding sun during the middle of the day, wearing protective hats and clothing, seeking shade while outdoors, and applying sunscreen to uncovered skin. Follow safety rules and regulations at your workplace. If possible, carcinogens should be replaced with safer substitutes. Workers should handle hazardous materials in a ventilated area and be trained to protect themselves. Personal protective clothing and respirators may be required. If you work in an environment with high exposure to fine particles, fibers, or dust, wear the appropriate protective mask over your nose and mouth and make sure it fits properly and does not obstruct your view. Make sure the room is well ventilated when working with solvents. Work outside if possible or open the windows. Avoid contact with pesticides. Exposure to pesticides comes largely through the skin. If contact occurs, wash up quickly. Avoid viral or bacterial infections. Do not engage in unprotected or otherwise unsafe sexual intercourse that may result in HIV, HPV, hepatitis B or hepatitis C infection. Do not use recreational injection drugs such as heroin or cocaine that may result in HIV, hepatitis B or hepatitis C infection. Get vaccinated against hepatitis B infection, an easy and safe procedure if you are 18 years of age or younger. Also, get vaccinated if you are over 18 and at risk of infection. At-risk people include healthcare workers, intravenous drug users, and homosexual men. Currently, there is no vaccine for hepatitis C. Seek medical attention for chronic stomach problems because they may be caused by Helicobacter pylori infection, which can be treated. Seek medical attention and adhere to recommended treatments if you have HIV or hepatitis C infection. These infections increase your risk of developing certain cancers. Because repeated exposure to diagnostic X-rays could be harmful, talk to your doctor about the need for each X-ray and the use of shields to protect other parts of the body. Check your home for high levels of radon. Radon levels in a home can be greatly reduced by a professionally installed ventilation system in the basement. We can take a few steps to try to detect cancer at an early stage. Tell your healthcare provider about the chemicals that you use at work or at home. With this information, your healthcare provider can perform appropriate medical screening tests for early detection of cancer. Ask your physician if there are increased cancer risks associated with your family or personal medical history or medical drugs you are taking. Appropriate screening procedures may be advised. Get a screening test done on a regular basis for these cancers. Breast cancer. A mammogram, an X-ray of the breast, is the best method of finding breast cancer before symptoms appear. Cervical cancer. The Pap test or Pap smear is the most successful screening tool used to screen for cancer of the cervix. Cells are collected from the cervix and examined under a microscope to detect cancer or changes that may lead to cancer. Colon and rectum cancer. The fecal occult blood test checks for small amounts of blood in the stool. A sigmoidoscopy or a colonoscopy are used to examine the colon and rectum.
Whenever a tumor or an abnormal growth is found in any part of the body in that condition, and even in the cancers of rectum, anal canal, even in the cancers of bladder, urinary bladder, whenever there is a painless bleeding from the rectum, whenever painless bleeding with the stools, painless bleeding with the urine, all this should be reported immediately to the doctor, since or not only because it is painless, we may ignore it. It is not to be ignored. The person should get vaccinated for hepatitis B at least. Certain other vaccinations are also available, and the person has to be alert for the changes in the body, any thickening or lump, any sore that does not heal, any nagging cough, any hoarseness of the voice, any changes in the bowel bladder habit, any unexplained changes in the weight, any unusual bleeding or discharge in the body should be reported immediately to the healthcare provider.
We have seen how cancer is caused and how it affects the system. Some cancers are curable while others are not. We cannot avoid everything that may cause cancer. However, we can adopt a healthier lifestyle and keep a very careful watch over our health so that the disease can be identified at the earliest. Early detection means that the disease can also be treated at the earliest, and this is the only way this disease can be controlled, and it can result in a healthier, longer and happier life.